let's talk a little bit about where I am right now. Some of you are interested, and if you're interested, that's great. If not, you can bypass this recording like any other recording. But we're in such a unique position now, and I'm talking in May of 2021. I'll be 71 years old in July. Some of you may be saying, all right, I'm on the verge of retirement. What am I going to do? I'm just going to tell you what I've done, and let's see if that gives you some tools as well. I began the AAIP, Danielle and I began the AAIP when I was 64 years old. By 65 years old, we had an associate in here, Dr. Michelle Furtado, and my son had already been here as a general dentist. Dr. Furtado took over all of the surgery very soon after I started. We took about a year for training, actually. Were actually trained under me, and he had the patience to train under me. That doesn't mean that he wasn't doing a lot of the work himself. He was, but we were checking along the way to make sure that he and I were calibrated together. And once we had that done and we were both confident in that, then he took over all of the surgery. So it's been 5 years since I've done any surgery at all. Maybe I've seen a couple of emergencies, but that's about it. What do? I'm working Mondays, Tuesdays, and Wednesdays. I'm seeing 19 new patients a week. That sounds like a lot to you, but that's what happens when you market, and that's what happens when you have a full-service practice, which is what we have. So understand that I'm the examining periodontist. Dr. Furtado is the treating periodontist, and he's treating here 4 days a week. And my son, Matthew, is here doing restorative dentistry 4 days a week. Why do I say this? I say this because this old idea that you need 8 or 10 referral sources, and you've heard me say this before, that's not true at all. We've got a major restorative practice, which needs a lot of perio, needs a lot of surgery, needs a lot of dental implants. And if you gear yourself, and if we geared ourselves in that direction, to be a major big case provider, it means that there's plenty of work for everyone to do, me included. That means we are doing full mouth treatment planning. Does every case come in that needs full mouth? Of course not. We're getting our 20-year-olds or 30-year-olds who need nothing. And not everybody needs the big case, but the fact they know they can get the big case done means that this becomes a destination location. I got to say that if it weren't for Danielle's management expertise, we wouldn't be there. And the fact that Danielle is teaching management expertise to others across the country, you can talk with them and you can see where they're going as a result. Yeah, it's a little bit of a plug for Danielle, of course. But you can do this as a treatment planner and as a full case provider. Now, what does that mean? It means that the physical wear and tear that I had as a member of the surgical corps isn't there anymore. Yeah, I'm working hard, but I'm working hard using thinking skills, not necessarily using physical skills and thinking skills. It's thinking skills only. It's talking skills, it's communicating skills. It's deciding what's the best treatment plan for that person. Not everybody can afford the best treatment plan. We know that. And so that we are able to come up with lesser treatment plans, lower treatment plans as necessary, phased-in treatment plans in order to be able to create what we want. I have 3 treatment coordinators, all of whom are capable of discussing all of the treatment with the patient. And so the goal is for me to spend a half an hour with a patient, and sometimes, by the way, I'll see that patient for another half-hour reevaluation as we're getting our ducks in a row, as we're referring out to the orthodontist and working through our treatment plans together. For the most part, we're able to get these patients done in 30 minutes of doctor time. And I've talked to you about that before. That means the treatment coordinators have a lot of responsibility. It means they do an awful lot of follow-up. It means that they have to know dentistry and know what I'm talking about. So when I say step 1, do this, step 2, step 3, step 4, step 5, they're right with me knowing exactly what I mean. So they can spend the longer period of time discussing it with the patient and making sure that if the patient chooses to, that the patient decides to go ahead with care. For those of you who are thinking about retirement, but you love it in the dental office, let me show you. Or let me tell you. It doesn't have to be that way. I like being with the patients. I like being with the staff. I like being with the doctors. Doctors and I meet every Thursday morning at 7 a.m. to go over cases. We have an orthodontist who's about maybe 3-4 miles away from here. We do a Zoom meeting with him every 2 weeks, where all 4 doctors are together, treatment planning together. It's fun. And so if you're thinking of retirement and you have the skills and you like to be in the dental environment, but you don't want to go through the backbreaking work, you don't have to. It's just a matter of putting the business skills together, putting the marketing skills together, and you can do it. And what's neat is those skills are out there. They can be outsourced. You don't have to do this. Yes, I'm supervising marketing, but that means I'm tracking statistics and I'm helping our marketing people do a better job, but they do a great job on their own. So for those of you who have that interest, who say, I like being around the dental practice, but I just don't want to do flap. I don't want to do tooth preparation anymore. We can do it. If you're interested in this, just give me a call, send me an email. In fact, send me an email first. And if you're interested in this concept of becoming a director of dentistry, a full-time director of dentistry, where you're running it without having to do it, just let me know. Okay? It's good to talk with you. And I can't tell you how much I appreciate the support that you've given to Danielle and me over nearly 7 years now of running what was the AAIP, still the AAIP, but the IDS section of the Institute of Dental Specialists. It's a thrill for me. It's another part of the retirement that I love. So imagine, I can be with you. I can do the things that I like to do. I can write, I can talk, and I can spend time with doctors and staff and patients and still have time for grandkids and hopefully some vacations coming up and those things I like to do. It's an ideal situation for me. Again, if you think it might be an ideal situation for you, I'd be happy to talk to you about it.